Hey, what's up guys, it's me, ThePsychNPDavidC. So these are the 5 psych medications that most people haven't heard of, but when they're used right, they're actually big game changers. Like there's a med for OCD that almost nobody uses. There's one antidepressant that's specifically approved for bulimia. There's a blood pressure medication that's used for performance anxiety, just to name a few. A lot of people assume all psych meds are interchangeable, but they're actually not. So these 5 meds are either FDA approved or have very strong evidence for their specific indications. Let's talk about it. This video is for educational purposes only and is not meant to be medical advice. So starting with number 1, we have fluvoxamine or Luvox for OCD. So Luvox is one of 2 antidepressants that are specifically approved for OCD, with the other one being Zoloft. So what makes Luvox so special for OCD? Even though it's technically in a class of antidepressants, like almost nobody ever uses it for actual depression. A lot of providers only use it to treat OCD instead. In a nutshell, Zoloft is kind of like a more general medication that helps with OCD, but Luvox is more targeted, more serotonergic specialist medication that can outperform Zoloft in pure or severe OCD. So now you might be wondering why someone would use Zoloft for OCD over Luvox. That's because Luvox has more side effects than Zoloft. Generally, more people are able to tolerate Zoloft than they are Luvox. Luvox tends to have more side effects like GI side effects like nausea, vomiting, or even things like drowsiness. And also the discontinuation symptoms can be worse than other antidepressants of the same class. So generally, if I have a patient who's struggling with depression and OCD, then I'll try Zoloft first because it's more tolerable. But if it seems like their OCD problems are more severe than their depression problems, I would actually try Luvox first. And also keep in mind that every person responds differently to medications than others. So someone may find that Zoloft is better for OCD than Luvox. But for the vast majority of people suffering from OCD, Luvox is more likely to be effective. And moving on to number 2, we have fluoxetine or Prozac for bulimia nervosa. So if you don't know what bulimia is, generally it's like somebody who secretly binge eats a lot and then later on goes to like purge it out either through like vomiting or, going out the other side. Prozac is the only antidepressant that's FDA approved to treat bulimia. It isn't as effective at lower doses though. It's FDA approved for bulimia at 60 milligrams, and the max dose for Prozac goes up to like 80 milligrams. At the 60 milligram mark, it's supposed to specifically reduce binging and purging frequency. So if I have a patient who's complaining of depression and they have bulimia, then Prozac is almost always the first choice of medication that I go to. It's best when it's combined with cognitive behavioral therapy as well. So the combination of Prozac and therapy should help with bulimia a lot. And moving on to number 3, we have lamotrigine or Lamictal for bipolar depression. Now with bipolar disorder, people usually go either into a manic phase or a depressive phase. Lamictal is effective specifically for the depressive phases of bipolar disorder. So if I have a patient who's bipolar, but they don't necessarily go into full manic episodes, maybe they just go into hypomanic episodes, and they have a lot more depressive episodes compared to those, then Lamictal would be one of my first choices for a mood stabilizer. And also another good thing about Lamictal is that it's a mood stabilizer that doesn't require regular blood draws. There's other mood stabilizers that treat bipolar disorder, like Depakote or lithium, but those medications require regular blood draws to ensure that the dose is within therapeutic range. Because if the dose of either Depakote or lithium is too high, they're gonna develop toxicity and have pretty severe side effects. With Lamictal, you don't need those blood draws. But one thing that's really important to know about Lamictal is the side effect of Stevens-Johnson syndrome. Basically, it's like a pretty severe rash. So providers should always start you at the lowest dose, which is about 25 milligrams. And then they'll monitor to see if you're developing any signs of rash. Because if you start at the lowest dose and you develop signs of rash, that's like a red flag to discontinue it immediately. So yeah, that's the one major side effect of it that's like really bad. It doesn't happen very often at all, but in some people it does happen. So if I start one of my patients on Lamictal and they don't develop any signs of rash at all, that's a really good sign to me, because that means we can go up on the dose and we don't need regular blood draws. We all know how annoying blood draws can be. And moving on to number 4, we have mirtazapine or Remeron for sleep and appetite. So Remeron, even though it's technically an antidepressant, a lot of providers use it for sleep and appetite. That's because its two major side effects are drowsiness and increased appetite. Now, at first glance, you might be thinking like, okay, so why would people use it if it's just going to make them sleepy and fat? That's because for some people with depression, they actually might develop insomnia and they might be underweight as well. Or maybe they lost their appetite because of their depression. So if I encounter a patient who's complaining of depression, but they're also not eating or underweight and they have trouble sleeping, then Remeron is a great first choice for their medication. Not only is it gonna help with their depression, but it's also gonna help with their insomnia and appetite as well. I see this a lot more frequently in elderly patients. Like there's a lot of elderly people that are like depressed and they're really like thin and frail and they can't sleep. So from my own personal experience, I prescribe it more for the elderly patients, but for any adult aged 18 and up, it's effective for them as well. And also a little fun fact about Remeron, it's actually more sedating at lower doses than it is at higher doses. It's a paradoxical effect that we won't get into, but it's a good thing to know. And moving on to number 5, we have Propranolol or Inderal for performance anxiety. So this one's really interesting because it's not traditionally a psych med. It's actually a beta blocker, which is used for hypertension or high blood pressure. But in psych, it has that one niche indication of being used for performance anxiety. So when I say performance anxiety, I mean like maybe someone who has to give a presentation in front of their class, or maybe someone has a job interview coming up. And when they're doing those things, they notice that their heart races really fast and maybe they start like shaking and trembling. What propranolol does is it's supposed to lower your heart rate so you get less heart racing and less anxiety in general. It's most often used as needed, which means you don't need to take it routinely every day. You would only take it when you're about to have a presentation or whatever is going to make you anxious. But since it is a blood pressure medication that lowers your blood pressure, if you have a history of low blood pressure, I would definitely discuss that with your provider first. And that goes for every medication. You should definitely discuss the risks and benefits of every medication with your provider before you take something. So let's do a quick recap on my top 5 niche psych medications. We have fluvoxamine or Luvox for OCD. We have fluoxetine or Prozac for bulimia nervosa. We have lamotrigine or Lamictal for bipolar depression. We have mirtazapine or Remeron for sleep and appetite, and we have propranolol or Inderal for performance anxiety. So these meds show how personalized psych treatment can be. So I want to hear from you, which medication on this list surprised you the most? Or if you have any questions regarding any of them, just leave a comment down below. If you found this video helpful, make sure to like and subscribe. It's going to help a lot more people see this video. I am also on TikTok and Instagram if you want to follow me over there at ThePsychNPDavidC. I do medication management for adults living in California. If you're interested, there's a link down below. And with that, your mental health just leveled up. You're welcome.